How is crypt hyperplasia interpreted in a gut biopsy? Imagine trying to understand what your gut is telling you through a tiny tissue sample. When doctors look at a small piece of your small intestine under a microscope, they search for clues about your health. One key sign they check for is crypt hyperplasia. This means the crypts of Leberkuchen, which are small grooves between the finger-like villi, are longer than normal. Normally, these crypts are short and help produce new cells for the lining of your intestine. But in some conditions, especially celiac disease, these crypts become elongated. This change is part of the body's response to gluten exposure, trying to repair damage but also indicating ongoing inflammation. When a biopsy is examined, the pathologist looks for several features. One of the main signs of crypt hyperplasia is that the crypts are visibly taller and more elongated than usual. This is measured by comparing the length of the crypts to the height of the villi. If the crypts are more than twice as long as the villi, it suggests hyperplasia. Along with this, they check for increased intraepithelial lymphocytes, which are white blood cells within the lining of the intestine. These cells increase as part of the immune response to gluten. The presence of villus atrophy, or flattened villi, often accompanies crypt hyperplasia, showing that the surface area for nutrient absorption has been damaged. Understanding these signs helps doctors confirm a diagnosis of celiac disease. When crypt hyperplasia is seen along with other features and positive blood tests for specific antibodies, it indicates gluten has caused damage to the small intestine. After starting a strict gluten-free diet, repeat biopsies can show healing. Usually within a year or more, the crypts return to normal size, and the villi regrow, showing the intestine is recovering. It's important to remember that crypt hyperplasia is not exclusive to celiac disease. It can also occur in other conditions like tropical sprue or certain infections. So, doctors interpret biopsy findings in the context of symptoms, blood tests, and other factors. Recognizing crypt hyperplasia helps guide diagnosis and management, ensuring that patients receive the right treatment and can heal their gut. In the world of gluten-free living, understanding what these biopsy signs mean can give reassurance that a gluten-free diet is working. It also highlights the importance of working closely with healthcare providers to interpret biopsy results accurately. This way, you can confidently manage your condition and maintain a healthy, symptom-free life.